Dr. Joshua Kolawole is a lean, agile transformational leadership trainer and healthcare quality and patient safety expert. He is a health system consultant, senior healthcare surveyor and assessor with extensive experience in health system strengthening, monitoring and evaluation, institutionalization of quality, and organizational digital transformation. He is a physician and the first Nigerian fellow of the International Society for Quality in Healthcare, Dublin, Ireland in 2014. He has a Master's of Business Administration and an advanced postgraduate diploma in clinical research and quality assurance. Joshua is an inducted member of the Delta Omega Honorary Society in Public Health from the Alpha Chapter, John Hopkins Bloomberg School of Public Health, Baltimore, Maryland, United States, where he obtained his Master of Applied Sciences in Patient Safety and Healthcare Quality, summa cum laude. He is a certified professional in healthcare quality, certified skilled agile framework delivery and project management professional. He has an excellent team spirit, having led teams and worked well in multicultural, multiracial, multi-generational, and rapidly evolving environments. Dr. Josh is a father, husband, coach, mentor, facilitator, speaker, and teacher of healthcare quality and lean agile transformational leadership values and principles. Dr. Joshua Kolawole lives in the United States of America.
According to Niccolo Machiavelli, we must understand that at any point where you attempt to achieve something of great worth, you are going to be faced with a lot of resistance. So there's nothing more difficult to carry out, no more doubtful of success, no more dangerous to handle than to initiate a new order of things. I want you to understand and let it be established today that if you set up your mind on a transformative agenda, charting a transformative course, if that is your goal, then you're on a dangerous path. It is not for kids. That path is for adults. It's for matured mind. It's for minds that are transformed. It's for minds who have made up their mind. It's not for those who at any point will self-sabotage by doubting along the path. So, the topic that we're talking about, I'll break it down into three. The first one is the culture of excellence part. The second part is the healthcare delivery, which happens in systems. And then the third part is the resource-restricted setting. I hope we're good with that. So I've broken down the topic into what? Three. The first part is the culture of excellence, which of course means transformation, which will lead to transformation. Then we have the healthcare delivery, which happens in a system, or as I've explained earlier, system in system. So, and I will also talk about the complex adaptive systems. And then we have the resource-restricted setting. I like to start most of my presentation with a story. I hope you don't mind. I want to tell you the story of the boy who cried wolf. He cried wolf because he's a boy. But the reality about this whole story is that it is more about the community of the boy than the boy. The boy was made to be in charge of the farm, which is out at the outskirts of the community. And the farm is like the source of income of that community. It's the main source of income. So they breed a number of sheep in the farm. Now, if you are going to entrust something of worth, like healthcare of your country, are you going to put it in the hand of a boy? Can I get a feedback? Something of significance, like the healthcare of a nation, no. Are you going to put it in the hand of a boy? No. That's the first problem, right? Are we seeing where the problem is? Now, the second thing is, if you look at the picture carefully, the boy himself is holding just a staff. When the boy cried wolf and ran to the community, the people in the community rushed out to come and support the boy. When they were coming, they came with gun. But they left the boy to be handling the major part of their economy with just a what? With just a staff. So when we ask leaders to commit wealth, to commit funding to healthcare, they keep saying that other sectors are a priority. But when COVID struck, we all shut down those other sectors and focused on healthcare. True or false? So why is it that we leave the staff to the boy who is handling the healthcare, which is the most vital part of our economy. Are we getting the connection between my story and the way our healthcare system is structured? So we structure a healthcare system in which we hand over the most important part of our system. We hand it over to immatured minds. We hand them over to minds who are not ready to lead transformation. You would understand why I call them immatured. It's not because I'm about insulting anyone. It's simply because the goal for healthcare is transformation. It's for us to fundamentally rethink, rebuild, relearn how we want to create our system. Healthcare system is so crucial. If I am not healthy, I will probably not be here. So that's how vital healthcare is. If we would drive productivity in any part of our economy, then it will be hinged on how healthy our population is. So this boy in the story cried wolf 3 times. The first time he cried wolf, he ran to the community, the elders came. When they came around, the boy laughed and said he was just joking. The second time he did the same thing. The third time, a real wolf appeared. The third time, a real what appeared? A real wolf. Medical error is a real wolf. People die daily. That's a real wolf appearing. If you look at the fragmentation in our healthcare system and the disconnect that brings pain, that brings a lot of prolonged hospitalization, that brings a lot of breakdown in the way our health system is supposed to operate, those are real wolves that will come. Infectious diseases will come. You would still have another epidemic and pandemic. They will show up. But as long as we have not mastered the art of ensuring that adults come over to take care of the health system, as long as I've not mastered that resources are committed to make sure the health system is strong, we will continue to have young minds who will be crying wolf, and our health system will still continue to reproduce the kind of results it generates. I'm sure you know it's Paul Bartaldin that says a system will continue to produce the results it gets. A system is designed to produce the kind of results it's getting per time. Whatever result you find in your life, in your system at this moment, is a cumulative of what you have built over time for yourself to be able to generate as of today. You can, in potential, build something more, such that the next 5-10 years will yield something different. Not to take too much of our time, culture eats up strategy for lunch. It can derail focus and it destroys vision. Of course, it's a popular statement in the management world. Culture eats strategy up for lunch. Some people prefer to use breakfast, maybe because that's more important to them. If we are to foster the culture of excellence in healthcare delivery, number one, we must think about transformational leadership approach. It is only in transformation that you can change something fundamentally and turn it to something completely different. I am talking about the culture changing completely into a completely different culture. The people changing into a completely different person in terms of character, in terms of competence, in terms of consistency, in terms of compassion, in terms of the courage to challenge transformational ideal. You will need a transformational leadership approach. When you embrace change, change is to change, to make something, to alter something within the same context. When you talk about transformation, you're actually changing the context completely. So, the idea is not that we need change agents. The idea is that we need transformational leaders who are willing to lay down their lives to see something completely transformed. The second part is we need systems thinking and strategic design if we're going to foster a culture of excellence in healthcare delivery. We will need system performance capabilities. I overheard a chit chat earlier about building KPIs, talking about performance improvement in health system, isn't it? Trust me, we need that far more than ever before now. We need at national level, at state level, at local level, what are the key parameters that we're tracking on a daily basis? How are we getting average on a monthly basis? What are we doing at system level to either improve the parameter if it needs to be improved or reduce if it needs to be reduced, because maternal mortality rate needs to be reduced, isn't it? Yeah. So we also need to think about the socio-economic value created by our system. How can we integrally create a coordinated and an integrated healthcare system that is accountable, that brings value, that brings wealth? to even the society. And the wealth is not only calculated quantitatively, but it's a wealth that is calculated both quantitatively and qualitatively. And that's why most of our research has to be mixed method research, where we analyze quantitatively and qualitatively together at the same time. And for me, I love measurement. But as much as I love measurement, I need you to tell me the stories behind that measurement. Without the story, that figure is useless. So if you come and tell me MMR is just 600 per 100,000, I don't need that in its absolute meaning. I need you to tell me the number of mothers that died for a reason why they should not die. And tell me why oxytocin is far more important to be present and why supply chain system has to be improved, so as to prevent that one, because for a single mother that died in a home, trust me, that's 100% for that family. So forget about the statistics you're quoting. And I also want us to build a system that has uniqueness. Branding is key and crucial to my heart. I love the culture of excellence. I want quality to be visualized at every system. I want formally and philosophically for people to see quality as a way of life. I say it this way, and please, if you ever visit any of your health facility, this is the first thing I tell them. I'm a senior assessor. I was trained by Farm Access Foundation, and it's a Dutch. It's been funded by Dutch Ministry of Foreign Affairs, and so I've done assessment across several facilities in Africa. I've reviewed data of several facilities, but this is the goal for me. Anytime I go on assessment, I tell facility owner, until I'm able to train your staff to become assessors themselves, then I cannot solve the problem of quality. How did I come to this conclusion? So I was in an assessment session with a senior matron in a facility. They had just had this neonate, and they needed to go and get hot water, is the water bottle that they use commonly, to just generate warmth around the child. Which, while we were walking through the store, I saw a brand new resuscitator, which would have done the function of providing oxygen, warmth, lighting, a bedding to take care of the child completely. This was kept in the store. A senior matron is in the facility. She knows how to use the resuscitator, but the resuscitator was not being used. All they needed to do was to be looking for hot water. So this brings to the idea that we need to make sure that formally and in the thinking of everyone philosophically, people understand what it means to assess healthcare facility and to be able to make a lot of distinguishing factors, because excellence, just like wisdom, tells us the ability to differentiate between the good, the bad, the ugly, the evil. And all these things are in grades. And then because of our time, I would also want us to know that if you're going to build a culture of excellence, it must be something that must be transgenerational. You will not build something that will fail after 10 years. Then that means we have not built fundamentally. If the foundation is sure, then the building is supposed to live for long. All right, so by way of definition, I just want to explain what I think about the culture of excellence. It is a way of learning. It's a way of thinking. It's a way of designing. It's a way by which we collaborate together. It's a way by which we act as a people in the healthcare system. It reflects ultimately the aggregate of the capacities in our minds. It reflects ultimately our attitudes towards quality improvement, towards healthcare transformation, towards system changes. It reflects ultimately the way we even establish our structures and how we define our processes. Because it is only with this that we can drive performance capabilities and we can generate outcomes of care that are transformational. The goal is the culture of excellence, yes. But the idea is that our capabilities are being developed further, and then the outcomes of our care are being transgenerational, transformational and transgenerational. So, if this is the accepted definition by all of us, I hope we agree to this definition before I go ahead. We all believe that it's a way of learning, it's a way of thinking, it's a way of designing, it's a way of coming up with collaborative effort, and it's a way of acting of the people in the healthcare system, which reflects the capacities of our mind and the attitudes of the people. And it's a way by which you establish the structures and the well-defined processes for driving performance capability in that system and at the outcomes of care. Now, I need us to pay attention to the word capability. It's an integrated word that has capacity and ability in it together. So, and I love using capability ahead of capacity because abilities also comes with the introduction of tools that would support us to do something better. Capacity comes with the strength of development that we have. I need us to, if you're not going to remember anything in this conference, please don't forget these 4 keywords as you go and as you try to make any transformational effort along the course of our lives. The first word is decisiveness. Decisiveness. The second word is consistency. The third word is strength. And the fourth word is maturity. But I would equate maturity to transformation or excellence as you want it. The first word is what? Decisiveness. The second word is consistency. The third word is strength. And the fourth word is maturity. You could call it maturity, you could call it transformation, or you could call it excellence. But don't forget those 4 words. If you're going to lead any major change anywhere in the world, either in politics, in family, in relationship, even between husband and wife, between the president and citizenry of a nation, if you're going to lead any major change, number 1 is you must be decisive. There must be clarity of what you want to achieve. It must be well defined. It must be clearly defined. And you must be able to articulate it to anybody, especially a 5-year-old boy, like they used to say. If you truly understand something, you should be able to explain to a 5-year-old. That means you must be able to simplify it from a 33,000 feet idea to a 3 feet idea. You must be able to break it down that simple. Number 2 is consistency. Whatever capacity you're integrating together, you must understand that once you doubt along the journey, you will self-sabotage and you will lose the strength of your consistency. Commitment is great to start an idea, but it takes consistency to finish it. Denzel Washington. So, you must understand that anything you do, you must calculate. I understood physics, and I understand the concept of frequency as the inverse relationship to time, right? F is equals to I 1 over T. Now, you need to get something. You need a regular cadence to whatever you want to do. If you want to be great, go and look at those who do financial contribution. How they become great is when they have a regular cadence to how they do the contribution. If they say we will be saving 10,000 every month for the next 10 years, go and calculate those who remain consistent. In 10 years, what they will have compared to those who are not consistent. You will see that consistency is crucial to any form of transformation. Compound interest also works based on the principle of consistency. The more you keep investing into it, the better the advantage of the compound interest that you get over time. And that's why it's talking more about rate, which is also the inverse of time. So why am I saying this? If you're going to build the culture of excellence and you want performance capability and great outcome of care, you will need to be decisive. So we will need, in decisiveness, don't forget, you would have to focus on some things that are very important to you. What are the priorities? You must be clear on what the priorities are. You must be clear on what your desires are. You must be clear on what the trade-offs are. You will trade off something to gain other things. Best systems of healthcare in the world does not solve all the problems in the world. What they make sure is, what are the priorities for our population? And they focused on it. I also overheard a question. What are the 5 most common courses for admission in the healthcare system in Tanzania, right? And so I went on Microsoft Copilot. I saw malaria, of course, always popular for sub-Saharan Africa. Classically, I saw road traffic accident. I saw upper and lower respiratory tract infection, pneumonia, most importantly. And so what came to my mind is, now that we have data-driven, data-based prioritization, why is it difficult for us to be decisive against these things? We already know the priorities. We already know that we need to work consistently. The challenge is that we have failed to build strength. That's the third word. we have failed to build strength. And that's why the concept of capability comes in. We must build strength. Number one, we must build strength in people. We must build strength in people. And that is why conferences like this, fellowship programs like this are crucial to the greatness of healthcare system in Africa. We must build people who are well-trained, who are seasoned in their field, technically. But we must, more importantly, build them to be adaptively strong. They must be resilient people who can think on their toes, who can think instantly. They must be people of strength. And they must build strength in their numbers when now integrated together. So at individual level, we need excellent minds. But at an integral level, when we integrate people together, we also need them to preserve that excellence. So what happens to Africa is that at individual level, we are great thinkers. But at an integral level, we fail the test of greatness. And it becomes more painful because what happens to us is we lose social value. And when a system loses social value, when you lose that social advantage, when you cannot define what is right at social level, then there's trouble. So we lost it at that social level. So at individual level, when you meet someone, they know that corruption is wrong. They know that self-sabotaging the supply chain just for personal gain is wrong. But because at social level, they are unable to stop it because there's no strength. So we need to build strength in people. We need this crucially. And that's why the concept of transformational leadership is so dear to my heart. It's so dear to the point that I know that it's an ideal I need to live by, and I need to keep transmitting that passion onto everyone that comes along my path. I need you to live here with a different thinking, a different passion, a different fire, a different desire, that any system that you hit after this conference or after following us through the whole cohort of this fellowship, any system where you find yourself, the way you see the system will be different. And the urgent need for change is what you start seeing. And by the time you start seeing that urgent need for change, you will have that drive to start collaborating with people. When the going gets tough, the tough seeks collaboration. You don't cave in, you don't give up. All you do is you seek what? Intelligent collaboration. And once you gain that intelligent advantage to collaborate with like-minded people to be able to start altering the system, you will still start generate enemies. You will have resistance. Be prepared. I told you Niccolo Machiavelli said it's a dangerous path to toe. So we all have to define, are we ready for the danger of transformation? And only adults are prepared to fight the battle of transformation. I love to call it, it's a battle. And you must have what we call a disciplined battle rhythm to be able to transform a system. Systems don't get transformed with complacency. Systems don't get transformed with gentleness. Systems get transformed with intelligence, with energy, with integrity, and with integration of effort, as in collaboration. So the fourth part is maturity. When the maturity of the mind of the people is strong, when people are matured in their minds, then they see a need not to resist transformation. I want to show us Tidake Health System in Wisconsin. In 2002, this became one of the best health systems in the United States in terms of integrated and coordinated effort. I had to dig into their history to ask why. Because they found something: leadership. You see, when you get the right and matured people into position, things will work as though. I was discussing with Dr. Onide Adeshola yesterday about if you want to work on a system, you need to think about the people, you need to think about the processes, you need to think about the technology. Technology is now critical to every system now. And you need to think about the business environment where you're operating from, right? But one thing that we both agreed to was that the people just makes the whole lot of difference. The people at leadership level and the people at even the followership, or what I call the frontline worker level. You must show that you're compassionate about the people at the front line. But much more importantly, Tidake's integration story does not start with technology. It starts with leadership. And what happened? They became the first health system in the nation to unify its hospital physician practices with health plan, with a single enterprise database, and integrated application for clinical care, registration, scheduling, billing, and even insurance care function. So, Tideke's system of transformation was a model in leadership commitment. But it will not happen. It will not happen if the leaders are not decisive, if they are not consistent, if they don't build strength. You would need to build financial strength. Africa needs to build a lot of innovative ways by which we can aggregate funds together to be able to drive health system change. I want to introduce to you Baylor Scott and White Quality Alliance. I volunteered for Baylor Scott and White when I got into the United States in 2019, up till 2022, thereabout. Baylor is a unique, and it's the largest not-for-profit healthcare system in the state of Texas. Texas, by the way, should be one of the top 10. If it were to be a country, it would be one of the top 10 richest country in the world. One thing that was crucial to the excellence or success of Baylor Scott and White is an integration of two hospitals, Baylor Scott and White. So you can see that. The first thing that was established was Vision 2020. This was done many years before then. Only leaders sees vision. Vision is not for kids. Let's be clear about that. What we're doing today, this fellowship, I already see in 10 years, I see in 20 years, the number of fellows across Africa, the integration of Africans in diaspora to this fellowship program. I already see that integration, and I see multi-layer, multi-roomed conferences where multi-sessions are ongoing together. But it's only leaders that sees. It's not for kids. And that is why we need to build community. If you remember my story of the boy who cried wolf, we need to build community where we only allow leaders who can see vision to get to position. Not just people who had stayed long in a system. So leadership position is not because of the length of time. Because the passage of time does not change so much. It is accurate reflection of experiences that actually makes a lot of difference in a system. It is not just about the passage of time. Its ability to have experience, reflect on those experiences, and then adapt based on the advantages that you have in that system to be able to keep building better. That makes a lot of difference. So Baylor Scott and White Quality Alliance is an aspect of Baylor Scott and White health system. And then they came up with a model to run the highest quality and experience of care for patients, most cost-effective and value-based system, improved health of the population, and they want to have the best coordinated care to the population they serve. And I love a story of their clinical integration, and I want us to always write this down so that anywhere we go from this moment onwards, please tell people this. They said, our accountable care with clinical integration is to ensure that the right patient receives the right care at the right time, at the right place, at the right cost, in a connected manner. I'll go over it again. The right patient receives the right care at the right time, at the right place, at the right cost, and in a connected manner, in an integrated manner, if you wish. The right patient receives the right care at the right time, at the right place, at the right cost, and in an integrated or a connected manner. So I would love us, every time we're faced with a health system challenge, the question that should run through our mind is, do we have the right patient? Do we have the right what? The right care? Do we have the right time? Do we have the right place? Do we have the right cost? And is the system integrated together to deliver on purpose? So because of that, I decided to explore the concept of culture of excellence in healthcare system. And I came up with these 4 crucial culture if you would like to drive health system transformation. The first one, I won't go deeply into each one. I will just talk about each of them at a broad level. We still have a couple of slides to go, and for time's sake. So, the first one is a just culture. We must first establish a culture that is fair and that does not blame. It must not be a blaming culture. Africa is noted for that, and it's an ideal that we hope to change, and we must keep challenging. The system must be built on transparency, open communication, and accountability. We must allocate resource appropriately. A just culture is a culture like this. Let me paint an example. You see, we have what we call reckless act. We have what we call sabotaging act. We have what we call at-risk act. Let me paint a clear picture for us. If I sit down here now and you serve me alcohol and I decide to drink beyond the normal level of alcohol that my body metabolism can handle, but I'm still seated here. I've not stood up to go and do anything, but I'm a risk to the society. I've taken an alcohol level that is beyond what my body can handle, isn't it? So that's at-risk behavior. If I now stand up and I say, I want to go and drive a car, that's a reckless behavior. Isn't it? If I get into that car and I make it to the highway, what is that? Sabotaging behavior. Now, what we do is that we have built a system that keeps people at risk behavior. But we have failed to understand that if it's not a system that has strong monitoring and evaluation, once you keep people at risk behavior, they will gently slide into reckless behavior. But we build a system that keeps praising people when they have at-risk behavior. So you have your head of finance. The guy has been slotting the funds for syringe and needle under another budget. Something you call padding. That is what? That's an at-risk behavior. At that point, he has not started an issue. But by the time you allow him over time, it will not only be needle and syringe, it will be medications, it will be medical technology, it will be other products. It will start adding more to the funds. He's sliding into reckless behavior. But the point where you see this sabotaging impact of his action is that a patient will come someday because there is inadequate supply of syringe and medical products. That young boy, a 5-year-old boy who will probably need an anti-malaria injection, will not get that injection. Unfortunately, that boy will die. The problem is not the day the nurse failed to give the child the injection. The problem started many years ago when the CMD of the hospital has tolerated an at-risk behavior from the head of finance. That is the blunt end of the issue. The sharp end is the day the boy died. Now, this is the whatness in our system. We will start crying on the day the boy died, and we want to put the blame on the nurse or the doctor who has failed to show up on time for the boy. But we have failed, we have forgotten that even if the doctor and the nurse showed up, they will not become artemether lumefantrine injection. And they will not be the one to go into the muscle of the boy and then distribute themselves into the system of the boy to kill the parasite and then to cause the boy to live. So, a just culture is a culture that looks at things at a system level. Are we together? Yes. And does not just isolate an event that happens at St. Nicholas Hospital and forgot that the problem might also be that the guy who signed off the approval of St. Nicholas Hospital from the State Ministry of Health could actually be culpable for an issue that happened in the O&G ward of St. Nicholas Hospital. Do we get what I'm saying? That's a just culture. So a just culture thinks at a system level. It doesn't place blame on anybody. Instead, it talks about collaboration. It talks about finding a way to coach, to mentor, to support people to become great. So, as leaders of healthcare system that were here today, our ideal should be what? Establishing a just culture in our system. Number 2, a resilient culture. A culture that anticipates that the wolf will show up anytime. Pandemic can show up anytime. And so it's ingrained in the thinking of everyone to put on universal protection. You don't wait until the day Lassa virus shows up or COVID shows up. You're thinking that you can have a DKA anytime. You're thinking you can have an hypertensive emergency anytime. And so because of that, your goal is to establish systems that are constantly evolving, constantly scanning, constantly adapting, and that is resilient in nature. You also must create a culture of improvement. If our goal is culture of excellence, learning and training, thinking and problem solving, improvement driven. We must be institutions that are driven by research and innovation. We must think like a product manager. A product manager is always thinking about new designs, testing market efficiencies, seeing things that would help its product make it well in the market, beat competitors, and especially be fit for purpose. So the question I want to put to you today is your healthcare system fit for its purpose? That's a crucial question. And then as leaders, we have to be strategic. We must be sharp. We must know how to make diagnosis of what are the real problems in our system. I'll give us an example. There used to be a building. I don't know exactly where it was located. But the challenge on this building is that they had to allocate money to repaint this building every year. And so the question came on a certain year after that budget was allocated. Why are we always repainting this building every year? So the first answer was, it's always having dirt from the waste from birds. So birds always come on top of the building and they excrete their waste product on it, and it stains the whole wall and gets it as in damaged. So at the end of the year, for it to look elegant again, we need to allocate money for what? Repainting. We're so accommodative. We don't want to kill the birds. So the question is, so why are the birds coming there? That's the second why, right? Why are the birds coming on the building? So we have to investigate. They noticed that at 7 p.m. every evening, insects come on the building. The birds come there to feed on the insects. And that's because someone was calm enough to ask the why. Because someone just said, let's just kill all the birds, get a chemical and kill all the birds. That's a good approach, isn't it? Yeah. But one thing you must not forget is that the chemical you're going to use to kill the birds may not kill humans instantly today, but they may be deposited in the tissues of men, and in 10 years could be the cause of their own cancer too. So you think you're only killing the birds, but you may be killing other things that are part of your system. And that's why I say your intervention, are you sure it's not destroying other part of your system? You may not be able to see the impact now. And that is why I said something. Only leaders see into the future. So we made an assessment and they concluded that, okay, the insect, then let's spray insecticide. Let's destroy the insect. Insecticides as well are chemicals, isn't it? They also have the potential to cause harm to humans, to destroy our ecosystem. So meaning, we are solving the problem, yes, but because we think our primary problem is the insect. But our primary problem wasn't the insect. So one guy now said, why do the insects come there in the evening? Something must be attracting them. So the third why now brought the question, okay, they went to study again and saw that the angulation of our light on the building attracts the insect at about 7 p.m. when it's getting dark. So the insects come towards the light and they aggregate there. Because the insect comes there, the birds will visit the place to feed on insect, and while they are feeding on insect, they pass their own waste, and then that destroys our wall, the paintings of our wall. Do you know what we needed to do as a solution? We only needed to change the angulation of the light. So it is only matured minds who are strategic in their thinking that takes their time to ask the 5 why question. You'd have heard about 5 why analysis. You keep asking why until you get to the final reason why something is happening. So let's now be factual with ourselves. The healthcare system is a complex human system embedded in a larger complex adaptive system. So if you think with all the passion I've been infused with, I'm just going to go back to my health system and I'm going to cause a change, I can promise you, you will run into trouble. Number one, the way the world works is broken. And your health system is a complex system in itself that is embedded in a global complex system. So Jeff Sutherland, one of the co-creators of Scrum, you would have heard about Agile Project Management somehow. Yeah. So Jeff is one of the co-creators of Scrum. He wrote a book, The Art of Doing Twice the Work in Half the Time. After the United States FBI, as popular as they are, and you think they're very efficient, they had wasted a lot of funds in developing a digital platform which would have prevented 9/11. 9/11 is a major disaster. The world should not see such disasters again. So, you need to start thinking in systems if we truly want to address the issue of healthcare. So, I want to help us to start thinking in systems now. The full continuum between the concept of public health, preventive medicine, and medical care, which we're now gravitating into precision medicine, is a total complex that we in the health system space has to deal with. Our challenges are from global to national, subnational levels, and even societal, to provider level, to family level, and even to patient level. It's that total for us. So as a doctor, you're not thinking just within the microcosm of your technical knowledge of how to handle malaria. You're thinking about the whole global space. What climatic conditions favors malaria? You're thinking at a national level, at a global level, how much funding do we have for malaria? You're thinking about vaccination. You're thinking about a whole lot of things. At the same time, you're thinking at the micro level about the family and the patient that is coming down with malaria. Now, this throws us into what we call, or popularly call, a complex adaptive system. In complex adaptive systems, there are 3 major cardinal things. There are interdependent agents. Interdependent means they could be dependent and sometimes they could be independent. Agents. There is distributed control. So, there is a control at the federal level, which is different from the control at the state ministry of health level, isn't it? And there's a control at the local level. But all these are different forms of control that have their own either dependency or interdependencies, as the case is. I'm sure you can relate to what I'm saying classically. You've been working in the healthcare space for a couple of years from my interaction. The problem with it is that there's no linearity of outcomes. So if I embezzle money at the state ministry today, you will not see the result instantly. The result might only be more apparent in 10 years. If the result had been acute, it would be easy for us to adjust and correct. But non-linearity of outcomes speaks to the fact that you cannot trace the error of your judgment today to an immediate consequence tomorrow. Just like if you give someone a high dose of insulin now, the guy is going to go into hypoglycemia in few minutes and is probably going to die, right? In like an hour at most, depending if you are not able to provide medical care. With that kind of direct scientific issue, we can find solution, isn't it? That's a linearity of outcome. Inject insulin and the patient goes into hypo. Really? But in healthcare system, it doesn't happen that way. So we keep making decisions in our boardrooms because we don't see the direct result of those things immediately. Then we don't really see the need to act. That throws us into a problem. This slide is so busy. I'm not so proud of it. But I just wanted to show you so that you understand the complexity of what you're dealing with. Government systems, from legal to judicial structure, from politics to geopolitics to ecopolitics to international trade and alliances, are creating problems in healthcare. We discovered something a particle from Wuhan in China, and by the help of airplane, in a matter of weeks, the whole world was in trouble. I doubt if there's any country that was spared. That's how international trade can change your dynamics within weeks. Societal, religious, cultural values and norms. Our educational institution and knowledge advancement institute. Technological disruption. The economic prosperity of a nation is also a crucial part. Geography and climatic conditions. Healthcare service delivery. And now there are popular uproaring between professions. Interdisciplinary complexities. Interprofessional complexities. I know about a country on the soil of Africa where other professions are where there's continuous fight within professions. So, at health professional provider level, we also have these humongous challenges. Now, for us to be able to do something great, these 6 things has to be in place. We must build leaders who can identify problems and think about their system-based root causes. We must build leaders who can develop strategic plans and interventional designs. We must build leaders who must foster integration by continuous engagement and continuous education. We must build leaders who will adopt implementation science to drive improvement, innovations, and transformation of their system. We must build leaders who are already skilled in the art of monitoring and evaluation, and they can adapt quickly and ensure that the nation stays resilient. We must build leaders who can scale up impact where needed. The health system we needs to provide higher quality, safer healthcare, reflect the population need, and facilitate better assessment and management of population health. I just thought to show this picture of what a system looks like. You know that we have structure plus process. This is a modified Donabedian quality concept. Avedis Donabedian is one of the fathers of healthcare quality, and he spoke to integrating structure and processes together without some direct output, immediate output. Integration of outputs together brings outcome. Integration of outcomes together over time brings impact. However, this is a function of the culture or the context where this thing is operating. That is why if I bring an innovation into Rwanda today, even though it worked well in the United States, it might not work well here. Because the culture and the context here is what? Is different. So I need to tailor my solution. So I need people to go into lean agile thinking if we are going to become great. One goal that I just need us as leader to start talking about. I'm not after so many things because I want to make your life quite easy, right? Please, everywhere you go, tell them, are you thinking about waste? How can we remove waste? So if a lean agile person, just tell them, how can we remove what? Waste. In healthcare. So we can now start talking about you see the topic of waste is a symposium discussion. But at least start getting them to be conscious about the concept of what? Waste. If we can achieve lean agile thinking, where people are so conscious of waste, wasted time, wasted human capability, wasted inventory, wasted resources, wasted motion, transportation of unnecessary things that do not need to be transported. Waste, just think through all your system, wasted funds. Think through all your system and say, how do we remove waste from? If you keep shouting that, I can promise you, your system will start auto-aligning itself. You must remove waste. I'm a lean agile person. I love lean agility. You need to know how much I detest waste of time, waste of resources, waste of talent. So everywhere you are, you must be conscious of the concept of waste. Hopefully, maybe after this session, we can have some questions and talk about waste in the healthcare system. So you can see the slide comparing nations' wealth and their healthcare expenditure. I just decided to show five nations. I picked United States, Japan, Nigeria. Maybe I'm emotionally attached to that. Then Kenya and Rwanda. But I decided to pick 3 African countries because we're on African soil. And I just picked 1 Asia representative and 1 America. Looking at this, I see Rwanda dedicate 14.8% of its budget. And that's the next to the United States. And I think the Abuja Declaration spoke to 15%. I hope I'm correct. Abuja Declaration spoke to 15% of your annual budget to go into what? Healthcare. If we're serious as a nation, that should not be a trouble, right? But we need to put adults in power. Because as long as we have people in power and there is inadequate resources for them to fight the wolf, even if the wolf shows up, we will all be in trouble. If we all believe that healthcare is the primary factor that drives productivity in any sane economy, then we would achieve 15% quickly. All right. What are the challenges of low resource setting? We all know there is financial shortage. But you know, if you listen carefully to me when I started, I spoke about conceptual financial shortage and the real financial shortage. There are two troubles that humans face. There's a trouble in our mind and there's trouble in our reality. When I spoke that leaders see vision, it means leaders have mastered how to see in their mind, right? So as a leader, your problem is not that the money is not adequate. Your problem is, how do I allocate these resources to build a system that over time more resource will come? Because you might not be able to solve the problem of the inadequate amount of resources immediately. But you must now develop conceptual thinking that will be able to use the inadequate resources that are available to be able to drive better changes. And then you create awareness that will bring more wealth. Now, don't forget, you will constantly be challenged by your frontline workers every day. They want you to start thinking about the inadequate resources. But you need that strength, conceptual strength, to be able to repurpose their thinking and build their focus over time. To think through how to maximize what we have on ground as against thinking about what we don't have. The problem is not the fact that the cup is half full. The problem is, what are you doing with even the half water in the cup? Forget about the space that is not filled with water. Focus on the what? The part that is filled, and develop excellence from it. You will attract the attention of the world. If you know how to burn so good that people will come from Asia to come and watch you burn. If you know how to dance so well that people will travel from Tanzania to come and watch you dance. If you know how to play golf, play it so well that people will travel to America to come and see Tiger Woods. Do you understand me? Yeah. Paucity of profound knowledge, and I use profound knowledge carefully, and the integration of that knowledge. The problem is not like there is no knowledge, but a lot of knowledge that we have is superficial. We do not walk the process to move learning from superficial learning to profound learning. And it's a painful reality. Anything you know and you have not subjected it to practical experience and let it test the implementation science of your reality, you do not know it. Go and tell anyone who says, I know. If it has not been tested with the practical reality of that person's environment and is still able to produce results, that is when you will say you have known. You must run systems and alter things. You must lead teams. You must generate results. And when you're not able to generate results based on the realities you have on ground, then we can say you have profound knowledge. So the challenges with Africa is we have so many professors of medicine who are ministers, professor of health something who are ministers, but whose knowledge has not been translated from superficial to what? Profound. To profound knowledge. And so when they get there, just a little mismanagement of fund will destroy their character. All they will need to do is to hang on for 7 years or 8 years until their tenure is over. But for someone who has profound knowledge, you are not only learning medicine, you're learning health financing. You're learning economics. Economics of the people, economics of scale, economic dynamics that drives the system. You're not only learning that, you're learning finances. You're understanding how systems integrate with themselves. You understand the impact of capacity building and training. So when people come to you that want to go for training, you won't scream at them. You won't deny them the resources to go. Because what use is a staff who is not trained to you? You insist that the guy should not go for training, right? But he's even useless as he's with you.
True.
So, influence of our societal beliefs and practices is significant on African soil. We have some geographical and environmental factors, especially in East Africa. There are a lot of hills and regions where accessibility is an issue, isn't it? And these are real things that causes constraint of resources. So, people don't even want to work in some regions because travel time to get to those places, supply chain management to get to those places, wars, issues along the line, along the road to those places are major geographical and environmental barrier, which we need to talk about, and these are major discussions. Restricted socioeconomic resources, underdeveloped national infrastructure and technological system. We also have challenges with our research system. The way we design our research and the way we even conduct our researches need a lot of planning and redesigning, a lot of fundamental rethinking. Then we have suboptimal healthcare delivery, which is normal because if we integrate such structure and processes that we have together, we'll definitely run into that. As I'm moving closer to the end of my slide, please, just some moments, I'll be done, and I'll get out of your face, please. All right, so I just want to remind you that the factors that are affecting culture of excellence in healthcare are this. I make sure they are dynamic complexes for you to think about. If you we'll probably share maybe like a PDF version of this presentation with all participants. So this is an analysis that's been done over and over and over at Valdemar's Intelligence. We've taken time to filter through so many materials. Number one, health system across the world, everywhere, including the United States, has fragmentation. We have improved to an extent with digitalizing our system. It has improved it has reduced the fragmentation and improved the integration. But it still doesn't mean we still don't have a lot of fragments that we're still dealing with. Number two is that there is overwhelming data of preventable medical errors and second victims in healthcare that we need to deal with. And now, it's not like those data has not been existing before, because even in the days of Napoleon Bonaparte, the guy said, I'm scared of two kinds of diseases. Number one, the disease that comes naturally, and the one that is caused by a doctor. So I was surprised that even in those days, they already knew that the health system could cause trouble. So it's not a new reality. Don't think it's because we're now having overwhelming data. That is when To Hair is Human, 1999 report, now became a popular this thing. Or Crossing the Quality Chasm, 2001, now became something of note. It has always been around us. Inappropriate variance in the quality of care across different strata. We have social determinants of health that we need to focus on. We have horrid waste in health system delivery, waste and delays that kills health system. No wonder timeliness is one of the crucial this thing for measuring quality. We have interdisciplinary, interagency, interdepartmental, and interpersonal frictions. We have not integrated along all those spectrum. We have poor proactive disease management. Now we are faced with two more greater challenges because we're now in the 21st century. Increased consumerism. Patients and family are now demanding right to own their care and make decisions. Don't you want them to? We all make decisions to improve our phones, to improve our vehicles. So why should I not make decisions to improve my health care and how I access it? So that puts us more under pressure. And then the more important one is that because of the history of poor care in Africa, we have created a new business of healthcare tourism that people prefer to fly to India if they are not going to Europe or America to seek healthcare, isn't it? Is that not happening in our system? It is. Because people have lost trust in our healthcare system. So we need to create systems to build trust back. I would like to start wrapping up with this story. This is myself and Don Berwick in Durban, South Africa in 2018 February. Just about the same time. I was in Durban. Don is a respected elder statesman in healthcare. He's one of the icons of quality improvement globally. is the founder of IHI. So it's an honor to stand beside him and to get a picture. But I want to tell a little story, and I'm saying this with all humility. This happened in the United States. Don is a product of Harvard. He's a medical doctor. He's also the son of a doctor. So, medicine runs in the family, kind of. His wife had a rare autoimmune disease of the spine, and they went through the health system. He had founded IHI years before then. But when he had a direct experiential understanding of how fragmented the health system was, Don told us the story. He said, before, I was concerned for the healthcare system. He said, now I have been radicalized. My goal today is to move you from philosophy to ideology. I need you to start seeing transformation of our health system as something you hope to live for, and if possible, die for. It's an ideal that you hope to live for, to see, to get transformed. We have a great icon in the United States. We're celebrating the Black History Month. And I'm sure you're all familiar with Dr. Martin Luther King Jr. I have a dream. Yeah. The truth is, he didn't see the dream come to fruition. But today, the son of a black man and the son of a white man are both seated in the same office and competing based on ideas, not based on skin color. Because someone had a dream. Because some people saw something beyond their immediate reality. Don said, before I was concerned about the fragmentation, especially because the simultaneous explosion of knowledge in the healthcare system now birthed more complexity and creates an urgent need for transformational leaders. So we need leaders in healthcare who will foster the culture of excellence. And because of that, I would like to tell us that we need a fundamental relearning, rethinking, rebuilding of our core processes. And like I said, we need visionaries. We need visionaries who are able to build coalition, who will be able to engage the political powers, that's the government, economic investors, because economics and politics are the power factor of every nation. Every one of us in this room, we're all driven by two powers, power of economics and power of politics. Those are the two only power in the world. They created the chemical, the nuclear wars, and other things. So in the bid to become politically dominant, you have to be nuclearly dominant, if I can use that word. We need sound discipline, but we need to think with the positioning of war intelligence. If we're truly radicalized, then it's time for war. We need sound monitoring and evaluation system, but we need to first define what the true North Pole is. Most nations don't even know what their true North Pole is. Because if you don't have a true North Pole, no, irrespective of what you're measuring, you'll be measuring based on false reality. We need wisdom from continuous learning. We need to keep creating solutions and drive research and discovery. Because for whatever we would do, we need discovery and development. Ultimately, we must know that great nations also enjoyed what we call the element of grace and some divine or kairos moment. Prior to the First World War, America wasn't the most dominant nation in the world. It was one of the great nations, but wasn't the most dominant. They leveraged on the Second World War. Every nation came to dominance. If you read human history from Egypt to Turkey to every nation you could, Media, Persia, they leveraged timing. If Africa is going to be great, we will position, but we will leverage time and chance. The goal for us is not to focus only on solving the healthcare problem, but ensuring that every one of us becomes transformed in our minds. If we're able to transform everyone from frontline worker, and we get every one of us to leverage the 9 agile quality minds for leading sustainable improvement, innovations, and transformation, this journey that I painted like a journey of the impossible they will start seeing that light at the end of the tunnel. Because like I said, it's the people that is important. When you get the right people trained and properly equipped at personal level, at social level, and at structural level, if you can integrate these three motivations and abilities together, and you're able to leverage it to make people strong, to help them to be decisive, consistent, and strong, you will better transform people. And by the time we have transformed people, I can wish you many great transformations in this lifetime and for many more generations that will mentor. Transforming the impossible, building a culture of excellence in the healthcare system is more about you. Moment defines leader. Crucial moment makes the difference. I hope we will all leverage this moment. Thank you so much.